Okay, so this is the neurological assessment. So first I would knock on the door and I would ask the patient, can I do a neurological assessment on you today?
Yes.
Okay, so the first step in a neurological assessment is checking the patient for orientation to person, place, and time. So you would ask questions based off of person, place, and time. So what's your name?
Michelle.
Do you know why you're here today?
Neurological exam,
What year is it?
2020.
And do you know where you are right now?
Yes.
Okay, so all those questions being asked, she responded to them correctly. So we would now rule out abnormal findings. These abnormal findings to the orientation test can indicate brain lesions, a stroke, dementia, psychological problems, or even medication side effects. So in the next step, we are going to be assessing all 12 cranial nerves. We're starting with olfactory, which is cranial nerve number 1. So can you occlude one nostril and close both your eyes for me? So in this case, you would wave a scent, a different one under each nostril, and test for sense of smell. So can you smell this for me?
Blueberry.
Okay, open your eyes and then occlude the nostril that you just swallowed out of. Close your eyes. Smell this?
Coffee.
Okay. So abnormal findings to this would indicate a problem with sinuses or possibly something wrong with your olfactory nerve. The next step in the cranial nerve testing is eye movement. So this is cranial nerve number 3, 4, and 6. So in these 3, you're testing the movement of the eyes laterally, medial, and downward. So I'm going to move my finger without moving your head, just follow my finger. Okay, any abnormal findings with this would indicate either a problem with the with one of the oculomotor nerves or something wrong with the neurological system. It could also indicate a stroke. That's a sign of having a stroke, is abnormal eye movements or irregular eye movements. The next part of the test is sensation. So with sensation, we are checking both cheeks, the forehead, and the jaw. This is CN5, which is trigeminal. So I'm going to take an object that has a dull and a sharp side, and can you please close your eyes for me? Okay, so this is what dull feels like. This is what sharp feels like. Tell me which one you feel when I place it on your skin. Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Any abnormal indications, if they could not identify if it was sharp or dull, could indicate a peripheral nerve disorder, which can further be tested. The other part of this test is for the jaw movements, which is also a part of CN5. So I'm going to have you clench your teeth and close your mouth. So when the patient clenches their teeth, you have to palpate the masseter in the back of the ear and the temporal to make sure that it pops out. Now, can you open and close your mouth for me? So this is checking the jaw movements, which is also CN5. And you're checking for crepitus. Any popping could indicate a problem with the jaw. Okay, so the next part of the cranial nerves is CN7, which is the facial nerves. So with this, you're just going to be testing out different expressions of the face. Any abnormal findings with this could indicate a stroke or any problems with the face. So can you smile for me? Can you frown? Puff out your cheeks? Okay, so can you open your eyes against my resistance? Okay, now moving on to, next is the whisper test. So this is checking for hearing and equilibrium. Any abnormal findings with this can indicate hearing loss, or one ear can hear better than the other, which needs further indication of the problem. So I'm going to whisper something in this ear and then something in this ear, and let me know what I said.
Apple.
Okay, the next part of the test is glossopharyngeal and vagus. So with these two, you're checking the gag reflex, vocal response, and the throat movement through swallowing. And you're also checking at the soft and hard palate in the back and the throat. So in this case, we don't have a tongue depressor, but I would have the patient open your mouth for me, and I'd have the patient say ah, and I'm checking the vocal response. And then I would take the tongue depressor and check towards the back and check the gag reflex. And now with that, I would have the patient, I'm going to check the throat movement. So can you swallow some of this for me? So when you have the patient swallow something, you're checking the throat movement to make sure that there's no abnormalities and everything seems normal with that. So any abnormal signs with this could indicate no gag reflex response, difficulty swallowing, which is dysphagia, and a raspy vocal response. So the next part is spinal accessories, which is the second to last cranial nerve that we test. So with this, you're just checking shoulders and head movement. So can you shrug your shoulders for me? Push against resistance. Push here. Okay, move your head up, down, side, side. Okay, now the last one is glossopharyngeal, which is the tongue. So with this one, we would have the patient stick their tongue out. Can you stick your tongue out for me? So when you're checking the patient's tongue, you want to look at the midline. If it deviates from the midline, an abnormal finding with this could be a stroke, or you could find a tongue lesion. And you're also checking for tongue movement. So can you move your tongue this way and the other way? And everything seems fine with that. So now we move on to the next part of the neurological assessment. Okay, in the next part of the test, we are assessing the muscle strength in the upper and lower extremities. So with the upper extremities, we're checking shoulders, elbows, wrists, and fingers. And in the lower extremities, we're checking hip, knees, ankles, and toes. So we're gonna start with the shoulders. So can you push, push? Can you take your hands and raise them for me? And bring them all the way back around and touch both your hands together in the back? Okay, so now with the elbows, can you push, push, pull, pull? With the wrists, can you flex, extend, push? There you go, push, push. With the fingers, can you fan them out, put them back together? Okay, now push against resistance. Push against resistance. So now you're going to do the same thing with the lower extremities, but before I move on, any abnormalities with any of this can indicate muscle weakness, which could indicate other problems. Besides muscle weakness, it can indicate a stroke or any problems with the muscular system. Okay, so with the lower extremities, actually stand up for me. So with the hip, can you push, push? Do you feel any pain when you do that? Okay, sit back down. So now moving on to the knee, can you push, 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 pull, pull. Okay, with your toes, can you push down, push down, push, push. Any pain felt in any of those areas? Okay, so the next part would be the Romberg test and the gait assessment. So can you stand right here for me and walk in a straight line? And then turn around and walk back. Now this time you're going to walk heel to toe, all the way there. And back. And now this time you're going to walk on your heels there and on your toes back. You can sit down. Next is, actually stand back up for me, I'm sorry. So the Rumberg test, so stand with both your feet together and close your eyes for me. Put your hands out front. And you would have the patient stand in this position for 30 seconds and you would check for swaying or imbalance. Any abnormalities with this could indicate something with the neurological system. With the gait test, any abnormalities with that could have been, we were checking for the stability and smoothness, so any miscoordination can indicate vertigo or poor sensation or muscle weakness. Okay, you can sit back down. So the next test is the heel to shin test. So can you take your heel and rub it on this? And then rub it on your other. So with this, you're checking for the smoothness and the coordination. Okay, so the next is the finger to nose test. So place your finger on your nose, and I'm gonna move my finger around and just touch your finger to my finger and then put it back to your nose. So you're moving it around to make sure that the patient has coordination and understand, that's good, and they understand where sense is. Abnormalities with this is that they cannot understand the movement that you're making. And then the next part would be rapid reflexes. So can you place your hands on your thighs and then take your hands and rapidly go like this? Okay. And then the last part of the test is sensation and stereostignosis. So with the sensation part, can you put your hand out for me? So I'm going to have the patient close their eyes and I'm going to write a number in their hand and they have to identify the number. So close your eyes for me.
3.
Other hand.
7.
Okay. Okay, so the last part is the stereostignosis test. So I'm going to place an everyday object in your hand. Can you close your eyes for me? And you have to identify the object.
Pencil.
Other hand.
Phone.